Order! Order! You are an incorrigible delinquent at times. Behave yourself, man!
Our goal is to get to a point where we can test, track and trace everybody who needs it. That's what the Health Secretary, Matt Hancock, told MPs yesterday. He suggested that very large-scale contact tracing would be in place within a few weeks because it is the necessary precondition for the government in Westminster to consider easing the lockdown. So how do they go about finding the army of people needed to track down who is infected, who they've been in contact with, and then, of course, to ensure that they are isolated? Well, whatever role technology plays in that, local council staff and civil servants are also expected to be roped in. Dominic Harrison is Director of Public Health and Wellbeing in Blackburn, and he joins us. Good afternoon.
Good afternoon, Sarah.
Would you expect to be involved in this new role that's emerging?
Absolutely. I would hope that local government would be part of a nationally agreed system, and that with the case finders and contact tracers, that workforce, which needs to be a new professional workforce within local government, would be based in local government public protection teams or somewhere else in local government. I mean, what you have to remember is that local authorities have the local intelligence, insight and networks, plus 170 years of experience of working with communities. And that is an invaluable asset if we're going to be effective at contact tracing.
But I notice you say would hope. You haven't been contacted to say, look, expect this to be coming down the line.
Well, I think there's currently a discussion about the whole system of case finding, contact tracing, testing and isolating that needs to be had in a joined up way. Some of the discussions that we've had so far have been perhaps less joined up than we would have hoped. And I think with the case finding and contact tracing, we're going to need three things. We are going to need some kind of app, some technology solutions. We are possibly going to need some kind of call centre capacity. But we're certainly, the most important bit of this is going to be probably about 15 to 30 case finders and contact tracers per 100,000 of the population employed within a local authority setting.
Right, and that's where you're talking about a new professional workforce. One of the suggestions had been that some of the 750,000 volunteers to the NHS could be used. It doesn't sound like you're thinking they are right for this.
Well, I really welcome the volunteers, and there are lots of things we would want volunteers to do, but I think in this case we are looking at this workforce being part of the mainstream local government NHS workforce that is going to manage this issue over at least 2 years, probably I would say until 2024. We are not going to see the opening up of the economy, the opening up of wider social restrictions until we've got the capacity to manage the numbers of new infections down and to keep that R value less than 1, because until we do that, we are not winning.
And just to be clear, do local councils already have people who are familiar with this sort of thing? Because you talk about local intelligence and local authorities. Would they have...
Yes. Yeah, local authorities have an excellent workforce of environmental health officers. But over the last 10 years, due to cuts to local government, that workforce, along with the wider public protection teams, have been devastated, and they struggle as it is to meet their statutory requirements.
But those that exist, they've basically done it because they've done it on whether it's, food poisoning or something like that.
Yeah. So environmental health officers do have powers and skills and training to do contact tracing and do it regularly in the case of food poisoning outbreaks and other infectious disease outbreaks.
Dominic Harrison, thank you so much. Well, the UK's planning for coronavirus is partly based on a review carried out by Dame Deirdre Hine into the last pandemic, swine flu, in 2009. It came here very quickly from Mexico, but was much milder, with only 457 deaths in the UK. She came up with recommendations for government and warned the danger of another, more severe pandemic has not gone away, and the governments of the UK must avoid complacency and use this opportunity to learn lessons and make improvements for a future in which resources will be tight. So I asked her whether we had been complacent.
I think we have. I think most people would agree that we have been complacent. We've been complacent while I understand that the danger of a pandemic was continually top of the government's risk register. I've no real insight into what happened, but given the pressures on public finances, the pressures on the NHS and so on, I think maybe the risk of a pandemic may have slipped a bit.
Professor Martin Hibbert was quoted in the Sunday Times this weekend. He's a professor of emerging infectious disease at the London School of Hygiene and Tropical Medicine. And he said, the interesting thing for me is I've worked with Singapore in 2003 and 2009, and basically they copied the UK pandemic preparedness plan, but the difference is they actually implemented it. Do you agree with that?
Yes.
Because what we had a very good plan, we just didn't act on it.
Yeah. There were different pressures on the UK than Singapore, of course. I mean, there may well be reasons for that, but I think that it's inevitable that one comes to that conclusion. We were slow to act in January.
Well, let's look at what the government has been trying to do, and not least was recommended to do according to the plan that you drew up, which is, first of all, the importance of data, the importance not least to the modelling and your predictions of what's going to happen, of data, which comes from, among other things, from testing.
Testing, tracing and modelling are a triad, and unless you do all of these things, you're not going to get the best data and the best pattern of spread of the disease. I find it difficult to understand why testing and contact tracing, it was done in the beginning and then stopped. I used to work for a boss who used to describe contact tracing as shoe leather epidemiology. And I think we've moved too far away from shoe leather epidemiology. It's labour intensive and it's time consuming. But without it, without knowing exactly what's going on the ground, the modelling is less useful than it could be. We could do it with an army of volunteers, or we could possibly do it with an app.
What else would you flag up now that the government should be doing that perhaps they're not doing?
Well, I'd like actually to talk partly about what they have done that I think they've done very well. And one of my preoccupations in my review was critical care and the problem of dealing with a surge in the requirement for critical care. And in that, I would congratulate not only the government, but the National Health Service. They have managed to increase capacity beyond what anyone could have expected. One of the other things I would like to congratulate them on too is the fact that they've included the contribution of behavioural scientists, and it's very clear that they've done that. They have tailored their communications, they have tailored what they are requiring of people, and it's fairly clear that they've had some very effective behavioural science advice.
You are now in your 80s and presumably spending a lot of time inside. Would you like more information from the government about what to expect in the months and indeed years ahead?
I think we would all like more, but I recognise that it is almost impossible for the government to give that with any degree of certainty. I think there is every hope that we will get a vaccine without too much delay. One point I would make, which I made in my review, is that the administration of the vaccine should be planned for at the same time as we are endeavouring to produce the vaccine, and that the arrangements, whether it's with GPs, pharmacists, whoever, for administration, I'm just hoping that they're really thinking hard about that at the moment.
Are you ready to be cooped up for more than a year?
I would find that extremely difficult. I live on my own. My husband died 18 months ago, and I find, despite FaceTiming with relatives, telephone calls, wonderful neighbours, I do find it difficult, and my heart sinks, I have to admit, at the thought of a whole year of this lockdown.
The next review is on May the 7th. Do you expect these restrictions to be in place for a lot longer than that?
Yes.
For all
I
of
would
us?
hope not for as long as a year, but I think probably for several months.
What, for all of us?
Yeah.
So everybody should expect
The danger of a second peak is very, very real.
That was Dame Deirdre Hine talking to me this morning.